Revision facelift surgery. So, how does your second facelift differ from your first? You guys asked me to talk about this topic a little bit, so let's take a beach walk. Um, Revision facelift surgery is something I know pretty well. About 20% of my practice is revision surgery, meaning people who have had a prior facelift elsewhere, they've lived their lives, they've enjoyed their neck and jaw lines, and now they're at a point where they need a tune up and they come to me seeking a revision surgery. Uh, Revision surgery, number one, is always more complicated because you never quite know what you're gonna find. Even in cases where I'm lucky enough to have that original operative report, there still can be surprises that you wouldn't expect, or ways things healed, or things that were left behind that make it a more complicated process. Craziest things I found on a revision. I found a metal cable, something called an eye guide. They used them in the late 90s, early 2000s, which was a way to tighten up those platysma muscles. They actually got a pretty good tightening, but having a metal cable inside caused a lot of inflammatory tissue formation, and those wires were prone to coming up to the surface. So I removed metal wires. I removed an imbrication stitch with thick blue, bright blue proline that was just under the surface of the skin and amazingly had not extruded. I've seen extensive scar tissue, which probably was from the use of fibrin glue. There was a period a while ago where everybody was using fibrin glue under their facelift flaps, and in some patients that created just a ton of scar tissue, which made the revision more difficult and more dangerous. Also, heat-based devices, especially some of the more invasive ones like FaceTite and Renuvion, I have seen extensive scar tissue essentially gluing the neck skin to the underlying muscle, which sometimes makes it extraordinarily difficult or virtually impossible to elevate those neck skin flaps. So revision surgery can be exciting. I enjoy it, but we have to acknowledge that because of all those unknowns, there's also more risk. And so with all comers, revision surgery has a higher risk of wound healing issues. It has a higher risk of potential nerve, temporary or permanent nerve injury. Knock on wood, I've never had one of those, but something that needs to be discussed. And then third, revision surgery may have a limited result just because the tissue can't move like it could with the original surgery. After scar tissue is created, it becomes more fibrotic. It doesn't stretch, it doesn't move like that first surgery. And so sometimes the result you can get with a revision surgery just isn't as good because the tissue isn't as good as the result you could get with that first surgery. So it leads to the final point that it's the most important surgery is that first one. And that first surgery needs to be carefully selected. You need to choose somebody who's going to give you a facelift that hopefully lasts you for 15, 20 plus years. You need to go into that surgery thinking that this is going to be it, and I don't want to have a revision unless this glorious thing happens and I find myself in my 70s and I'm still feeling like a 20-year-old and I want to get a tune-up. That's why I don't perform and I don't support doing mini lifts and lower lifts and these sort of half things that set you up for needing something in 5 years. Because that surgery in 5 years is still a full revision, regardless of what was done that first time. And your results may be limited, even though you could have gotten a really good result out of the gate on that first one. Simply because there was a prior surgery and there's scar tissue and other things that happened. That's also why I encourage people to wait for that first surgery until you're actually going to see a result. I don't perform deep plane face and neck lifts in 35-year-olds because you're not ready yet in terms of skin laxity. And so you are essentially dooming yourself to have a revision sometime in your late 40s, early 50s, when you probably were really ready to have that first facelift anyways. Don't tread into it lightly, and choose the right surgeon who's going to do the right thing, who's going to care about your tissue quality and mobility, and make sure you get that fantastic result out of the gate, so that whoever has to revise it when you're in your 70s and 80s is going to have an easy time and get you that best result ever, or you're just going to sail on and never need a revision. So thank you for coming with me on this beach walk on this stormy day in Myrtle Beach. I hope you all have a good day.